There was like one section where you kind of talked about the different airway adjuncts as
Mhm.
far as like, supportive care or you're actually fixing ventilation. Um, and I remember when we were doing a review in class and they were deciphering, I guess, with the new ACLS standards as far as when to ventilate
Mhm.
between like the standard that everybody typically knows if they're below 94, you're given oxygen. But then if it's you only give it if it's below 90. Just kind of the different levels of at what point would you give what. Obviously, if they're shallow and slow, you're
Okay.
ventilating. Just
Okay.
kind of deciphering the different ones depending
So
on what you
there's
see.
one triangle we're going to use. All problems come down to what?
It's the oxygenation, ventilation, or perfusion.
Okay. Now, so remember, and I started talking about this today. We have ischemia, then we have hypoxia, we have respiratory distress, then we have respiratory failure, then we have respiratory arrest. Oh, you're not seeing what I'm doing. Then you have cardiac arrest. Okay. Notice how I have these color coded. Everything in red is primarily a ventilation problem. Everything in blue is primarily an oxygenation problem. Everything in purple is primarily a ventilation problem. So the biggest thing you got to figure out is this oxygenation versus ventilation? Okay, that's what you're asking me. You're saying, how do I figure out an oxygenation versus a ventilation problem? Okay, an oxygenation problem. There are two things we do to fix an oxygenation problem. We either do something with the airway or we give them oxygen. Okay. If it's doing something with the airway, we only have like three things we do. We either open it, we clear it, or we keep it open. How do we open it? Head tilt, chin lift, jaw thrust. When do we do what? Head tilt, chin lift, medical, unresponsive. When do I do a jaw thrust? Trauma.
Mhm.
How do I clear it? Well, I primarily clear it with suctioning. No more than 10 seconds for a kid, no more than 15 seconds for an adult. How do I keep it open once I have it open? With an airway adjunct, OPA or an NPA, unless it's contraindicated. What's a contraindication for an OPA? Gag reflex primarily. What's a contraindication for an NPA? Basilar skull fracture, head injury. Okay? O, O2. Because if I open the airway, now oxygen can get in. If I give oxygen, oxygen can get in. Oxygenation is all about getting O2 in. Okay. How do I give oxygen? Well, it's either mild respiratory distress, moderate respiratory distress, or severe respiratory distress. Mild respiratory distress, they're having trouble breathing, but they're able to talk, they're able to get out a lot more words. I'm probably going to give them a nasal cannula at 1 to 6 liters per minute. If I'm using a capnography nasal cannula, I'm going to go 1 to 5 liters per minute. Moderate distress. It's a little more effort. They may have some accessory muscle use. They're struggling a little more. Maybe they're talking in 3, 4 words, 2 words even. Okay, now I'm going to go with a non-rebreather. I'm going to go do that at 12 to 15 liters per minute. If they have moderate distress plus wheezing, I'm going to go with a nebulizer. I'm going to do that at 6 to 8 liters per minute. Now, what if they have severe respiratory distress? Well, now they're talking in 1 word sentences, like they can only get out like 1 word at a time between breaths. I'm probably going to need to escalate to something like CPAP, unless it's contraindicated. What are my contraindications for CPAP? Not following commands, unresponsive, altered mental status, hypotension, vomiting, secretions in the airway. Okay, but that's how I fix an oxygenation problem. How do I fix a ventilation problem? Well, how do I know that they have a ventilation problem? Well, if they're in respiratory failure or respiratory arrest, those are ventilation problems. How do I recognize respiratory failure? Well, not only are they short of breath, they're probably altered. They probably have altered mental status. They have words like shallow breathing. Another way to say that is inadequate breathing, poor chest rise, labored, fatigued. That all points to respiratory failure or slow. So that's going to be respiratory rate less than 10 for sure. Now, respiratory rate greater than 30 may be respiratory failure. It also may be respiratory distress. So we can't always just look at the rate unless it's slow. If it's slow, less than 10, bingo, respiratory failure all day, every day. If it's greater than 30, I got to see if they got something else like shallow, inadequate, poor chest rise, labored, fatigued, stuff like that. If they have any of this, this is BVM territory. They're going to get a BVM, but we never do a BVM by itself. We have to power it up with oxygen. And if I'm at the point of needing a BVM, because the way you want to think of this is respiratory distress is they're struggling, but they can still do it. They can still fight. They're still in the fight with me. Respiratory failure is they're no longer in the fight. So now I got to fight for them. Make sense?
Mm-hmm.
If they can still fight, I'm just going to I'm going to support them with oxygen and say, look, let me give you some oxygen and you do what you can with this oxygen I'm going to give you. But when you quit fighting, I'm going to say, look, get out of the way. Let me fight for you. And I'm going to fight for you through my BVM. Okay? So the way you want to think is, can they do it on their own? Yes or no? If they can still do it, we're going to support them with oxygen. If they can't do it, I'm going to take over. Okay? Did that answer your question?
Yeah, because I just know in some of the test reviews and questions I've done, like
Oh,
that's
this
an
is a
op.
huge topic. In
Yeah.
fact, let me see if this is inside. I don't know if this is where everybody has access to it or not. Let me see if it's under the free training videos section. I don't think it is. There is a part in the NRMT Pass Study course and the, let me show you what I'm talking about. In the NRMT Pass Study course and the 14 days program, there's this part here for, all right, here's what I'll do. Send me a message. There are two things I want you to look at. One is this OVP guide. The other is this handout these right here. The video OVP, so oxygenation, ventilation, perfusion with drawings, and this OVP guide. These are, or this one, this respiratory failure. This would be a great thing to review today because this is heavily tested on everybody's test. Like you got to know the difference between respiratory failure and respiratory distress. Hang on one second. Okay.
Mm-hmm.
Send me a message and I can send you those links. All right. Anything else? Okay.